Speakers, I highly appreciate the efforts of the Honorable Minister with regards to the Health Department, also the Dean, the MS, and all the doctors, nursing, and all the staff at GMC, and all the healthcare centers across the entire state. The Honorable Minister has been instrumental in improving the healthcare scenario in the entire state over the past couple of years. However, Speaker, sir, I would like to point out that the North Goa District Hospital requires his urgent attention. Many a times we are merely facilitators while discussing with the patients that call us, our voters, our families, our friends, and I'm sure that all the other members have also expressed the same concerns, whether it is the North Goa Hospital or whether it is the South Goa Hospital. We see that a lot of cases are usually referred to GMC. And just like all my other colleagues have spoken about, why do we not decentralize GMC? I was at GMC just 2 days ago at about 12 a.m. with someone who met with an accident, and I could see the situation and the crowd that was there at that time. And I'm sure that if both the North Goa Hospital and the South Goa District Hospitals could accommodate and could manage such incidents, that would also provide relief to GMC as a whole. The patient that I went to see met with an accident in Dargal and could have easily been treated at North Goa District Hospital. Unnecessary, he had to wait for almost 4 hours before he got treated. This is just one case, and I'm sure that these are the cases that we as legislators are made aware of. But I'm sure that there are so many other cases that go unnoticed. So I believe that it is very important that we try to do our best to make sure that the district hospitals can manage this at an immediate basis so that the patient gets his treatment within the first hour of being at the facility. Speaker, sir, we know that the Asilo Hospital at Mapsa lacks the necessary equipment and facilities, which results in these hardships for everyone in the Taluka and everyone in North Goa. Subsequently, I would like to make a special mention about the sonography, which takes about 3 months, and an echo, I believe, was told to me that it takes about 4 months. There is a CT scan machine that has been out of order for the last 3 months. Furthermore, MRI patients are referred to GMC, where the appointment takes even longer. We need a full-time MS at the district hospital, and there is a big void in the district hospital's administration. The doctors on bonds are a stopgap arrangement, and there is a need for permanent staff there. Another pressing matter is the incubators and ventilators for newborn babies, which are either referred to again to GMC. And the private hospitals turn out to be very expensive for the common man. So I believe that if this is addressed, this can also take care of that situation. Speaker, sir, we have a morgue with a capacity of 12 compartments, which are occupied by 6 unidentified bodies, and the police are yet to identify these bodies. There apparently is a body that has been there since COVID. 4 of those morgues are not in working condition, and 2 that cannot, we are left with only 2 that cannot sustain the requirements. So all the bodies that are brought to the district hospital are shifted to GMC, wherein again there is a big load on that hospital. Speaker, sir, to avoid this, I would like the Honorable Minister to currently, as he is quite dynamic and very efficient in his way of operating, so is his entire office and his entire team. If a little attention or a little time could be given to district hospital, I am sure that we could resolve the same. Speaker, sir, coming to the UHC MAPSA. UHC at MAPSA has been operating without a building for the last 3 years. Through your good office, they are currently being hosted at the physiotherapy center in the old asilo down in Angod in MAPSA. As I mentioned the last 2 assembly sessions, that there is a property, but the building is in quite a dilapidated state. So if you could try to provide us with the new infrastructure. MAPSA being the capital of Bardez and being a town, it is a very important central location, and the UHC is very, very much the need of the hour. The staff strength at the UHC is not up to the mark. We require a full-time sanitary inspector to carry out the works. We do not have a vehicle. The staff is using their private vehicles for inspections. This request has been put to you a couple of times. I would request your office to kindly make sure that we are provided with the same. Speaker, sir, like my colleague Bab Nilesh Cabral mentioned, with regards to the FDA, the food is the most important item that we consume every day, 3 times a day, sometimes 4 times a day. We see a lot of eateries all across the state. I do not know how many of them are operating with the permission and the approvals of the FDA. I believe, being a tourist destination, I believe that since we have so many options to choose from different types of foods across the state, it would be very important that we kind of make things a little stringent to ensure that each and every eatery, each and every restaurant that operates gets the clearance from the FDA before operating. So I believe that this drive is very, very important from your department. With that, I would like to conclude, Speaker, sir. Thank you.